Hi, my name is Kathleen Wheeler, and this is my needs assessment project for summer 2018. So the purpose of this was to focus on an acute rehabilitation setting with physical therapy, occupational therapy, and speech therapy if needed. It's roughly 2 to 3 weeks of progress. Limited time is there to help the patient gain new skills, gain strength, and endurance. Sometimes these patients don't have family support or resources in order to have a safe discharge. So my entire focus was the safety of the patient and a safe discharge. For my data collection, I interviewed 3 different people. The first one was a case manager, and in this we decided to have this interview in order to see what their day-to-day process is when following their assigned patients. The social worker I interviewed put a lot of emphasis on the safety of a patient and how sometimes they don't understand that going home may not be an option. Sometimes they set goals that are unattainable, like being able to walk out of rehab without a walker and take care of themselves alone at home, even though they may have experienced a huge stroke and need a large amount of support. So this is not only difficult on the patient for having to process this information, but now the case manager needs to get them discharged in a timely manner so the insurance will cover it, but they need to get them the correct sources. The next interview was kind of difficult because it played more on logistics instead of that emotional support that a case manager provides. It was with the financial controller, of the rehab. And so how they take patients in, they run all the numbers, and they base everything on a corporate quality measure that the rehab sets for itself and their team members. So they set authorization scores, meaning the insurance, how long they're going to authorize their stay. They do a functional improvement measure, so they look at the acuity of the patient, how severe they are, and then base how many days they get at the rehab based on what kind of improvement they think they're going to make. And then lastly, they have an efficiency measure, which holds the team accountable, meaning is physical therapy doing their job correctly, is occupational, and is speech. So to my understanding, I thought that everything the rehab did financially was state mandated based on how many people that they can send to a skilled nursing facility, home health, etc. But after this interview, it shed light on how strictly the financial controller balances the system, which is extremely important to have that kind of member, but it's difficult when you have someone like a social worker who bases a lot of things on empathy when it's the real world and you have to measure things based on numbers and revenue. My last interview was conducted with someone in a skilled nursing facility / senior care, and this took several people to try to find to actually interview. So this was a difficult one to schedule, but it was a very kind and nice interview. I just kind of discussed more readmission into the hospital. Obviously, they want to avoid that, but it does happen, so it was kind of a darker topic to talk about. And we talked about the patient's continuation of care. Is that nursing team continuing those skills that they obtained in the rehab? Are they practicing these occupational therapies, or are they lacking that? And is it a safe environment for the patient post-discharge from the rehab? Because, like I said, sometimes they're not going to go home. That's not always the case, and it's hard to have that conversation, but it's important to have it. My findings showed that the patients need to have better education on their impairments and their abilities. Currently, it seems as if they have these grand goals of walking, but they experience significant deficits. Then they need to have that honest conversation. This may hurt, but having a comprehending conversation of what their new baseline is will keep them safe and may prevent readmission into a hospital. So each person I interviewed have a huge impact on the patient's care, and it is a result of how the individual's discharge will go. There seemed to be a pretty big lack in communication between a case manager who follows their care, the financial controller who's focused on the money and how they stay afloat, and budgeting, and then the follow-up with the post-discharge and how the patient's doing in their new location, in this case a skilled nursing facility, home care, hospice care. So my recommendations for this were, number one, to have a team meeting. I think it should be held with all disciplines, including physical therapy, occupational therapy, speech, and the case managers, in order to have an honest conversation Safety is the number one priority for the patient, and hopefully, but by keeping them safe and providing them with these tools, they can use post-discharge, and then they may prevent readmission into the hospital. That's ideal. Number 2, I said meeting with the financial analyzer versus the case management. We are all here to help the patient in the best interest in mind, so it's imperative to be on the same page. If both sides thoroughly speak out their struggles or issues prior to the discharge, then there should be a better hope for safety or the safety of the discharge for the patient. I would suggest a bi-monthly meeting to meet with the difficult patients and evaluate their options for healthcare and how it kind of intertwines with the financial ability that the rehab has. This should hopefully result in a safe discharge with the most beneficial outcome for that patient. And then furthermore, this will give both parties more of an open communication with each other. And then throughout this, kind of more of a reflection, the positives were there was a willingness to have an open conversation. Each person I met does take care of the patient. However, they don't communicate well with one another. So hopefully that this needs assessment will help open their eyes a bit. The experience through the interviews were a little difficult for me, but they were conducted well, and I had really good examples to go off of. And then each person I interviewed wanted to make a change in the future. They see the issues with the discharge and they wanted to change, and so I think that's the first step. The negatives, all 3 were very set in their ways, in their disciplines, so it was kind of hard to open their eyes to the struggles that each person sees. There's always 2 sides to the story, so that was kind of difficult. And then trying to schedule time with the nursing care, because I had 3 different interviews set up and I had to constantly reschedule. And so I had to find a different facility at the last minute. And then reflection self would be, I'm fortunate enough to live in such a cohesive community that people are willing to change. And then I'm happy that I'm going into a field that we have the best interest in mind for our patients at heart. So this project helped me realize that. And then I learned how to conduct a constructive but comfortable conversation with each person I interviewed, and it progressed very well. And then at the end of the day, just understanding that assessing takes time and there will always be setbacks, but you can always make a change for the better.